cholesterol and heart disease.
Alan Arkin, their character actor, has died.
In the U.S., somebody has a heart attack every 40 seconds.
There really is no cure for heart failure.
The single most common presentation for a myocardial infarction is death.
Cardiovascular diseases are the top cause of death in the world.
Heart disease ranks as one of the most terrifying illnesses out there, and it doesn't care about your age or how fit you look. Anyone can find themselves at risk, so staying on top of your health game with some solid precautions is the way to go. Heart disease is a top killer around the world, and its impact varies by region. In the US, it claims about 695,000 lives each year, making it the #1 cause of death. On a global scale, cardiovascular diseases account for 32% of all deaths, with most occurring in low and middle-income countries. In China, cardiovascular diseases have become a huge health issue, with around 330 million people affected in 2019. Meanwhile, in India, coronary heart disease rates are skyrocketing, especially in urban areas, where they're double that of rural regions. Recently, some well-known figures have lost their battles with heart issues.
39 years old, found dead inside her New York City apartment.
Her shocking death making headlines. The question, why?
In December 2024, former Playboy model and actress Ariane Bellemare tragically passed away at just 46 due to a heart attack.
Playboy model Ariane Bellemare has died. She was 46 years old.
Similarly, British TV presenter and comedian Paul O'Grady died at 67 from sudden cardiac arrhythmia in March 2023.
Comedian and TV star Paul O'Grady has died at the age of 67.
In December 2016, British singer George Michael died at 53 from dilated cardiomyopathy with myocarditis and a fatty liver.
Who have confirmed the death of the singer George Michael at the age of 53.
In February 2012, American singer and actress Whitney Houston died at 48 from accidental drowning caused by atherosclerotic heart disease and cocaine use.
Singer Whitney Houston, one of the greatest voices of our generation, CNN has gotten confirmation from her representative, has died.
These cases show how heart disease affects different people from all walks of life. The stats and stories highlight the urgent need for public health efforts aimed at prevention, early detection, and managing heart disease, especially in areas where it's most common. Tackling lifestyle factors like diet, exercise, and smoking, while also making healthcare more accessible, are key moves to lessen the global impact of cardiovascular diseases.
Having basic knowledge about heart disease could help save your life.
Excessive alcohol consumption stands out as a major player in heart health issues, leading to problems like arrhythmias, cardiomyopathy, and even cardiac arrest. The connection between heavy drinking and poor heart health is clear, with many incidents highlighting how personal habits can have severe consequences. In today's media-driven world, the glamorization of alcohol in movies, TV shows, and social media normalizes excessive drinking, especially among younger people. Portraying heavy drinking as a sign of success or social acceptance downplays its serious health risks and fuels a cycle of behavior that increases the chances of heart-related emergencies.
Alcohol is something you just have to be a little bit more cautious with.
With constant exposure to these messages, it's tougher to challenge the idea that alcohol-fueled lifestyles are the way to go. This makes it crucial for public health initiatives to tackle both the cultural and health impacts of excessive drinking on heart health. On a global scale, well-known figures like Martin Luther King Jr., John F. Kennedy dealt with ongoing heart issues. Legends like Elvis Presley and Frank Sinatra had fatal heart attacks, often made worse by being overweight, using drugs, and drinking too much. Even icons like Steve Jobs and David Bowie faced deadly heart events along with other health problems, driving home the message that neglecting health can have serious consequences. Preventing heart disease involves adopting a healthy lifestyle, including keeping your heart healthy means taking a well-rounded approach that mixes lifestyle changes, good eating habits, and holistic practices. Getting regular exercise, whether it's brisk walking, cycling, yoga, or any moderate activity, helps your heart function better, manage weight, and reduce stress. Pair that with a balanced diet filled with fruits, veggies, whole grains, and lean proteins. On top of that, adding key minerals and vitamins to your diet can boost your heart health. Minerals like magnesium and potassium help regulate blood pressure and keep your heart rhythm steady, while calcium is important for the strength of your heart muscles. Vitamins also matter. Vitamin D helps control blood pressure. Vitamin E acts as an antioxidant, and vitamin C is key for building collagen in blood vessels. Omega-3 fatty acids, found in foods like salmon and flax seeds, reduce inflammation and lower triglyceride levels, cutting down on cardiovascular risks. Plus, B vitamins are crucial for energy production and keeping your metabolism running smoothly, making sure your heart gets the energy it needs. By combining these lifestyle changes, healthy eating, and mindful practices, you can build a solid plan to prevent heart disease and keep your cardiovascular health on track. Keeping your heart healthy goes beyond just personal discipline. It's a commitment backed by top research institutions and leading cardiologists.
4 major things that I recommend to patients to prevent a heart attack. 1 is to eat better. 2 is exercise. 3rd thing is stress. 4 and final, and this is an interesting one, most heart doctors never talk about love.
Experts highlight that making lifestyle changes is crucial for preventing heart disease. For instance, Dr. Angie Brown emphasizes managing blood pressure, staying active, controlling cholesterol, eating healthy, quitting smoking, managing stress, keeping a healthy weight, reducing alcohol intake, and even learning CPR as essential strategies to fend off heart disease.
The good news is that 80% of heart attacks and strokes are preventable.
The American Heart Association, AHA, has done extensive research showing that combining regular exercise, a nutrient-rich diet, and stress management can cut cardiovascular risk by up to 80% when these habits are maintained over time. Similarly, the Cleveland Clinic stresses that simple daily tweaks, like adding ginger, garlic, and turmeric to your meals, can significantly boost anti-inflammatory effects and improve circulation. Teams at the Mayo Clinic have also found that important vitamins and minerals, like magnesium, potassium, and omega-3 fatty acids, play a key role in supporting heart function and preventing irregular heartbeats. The European Society of Cardiology, ESC, has been pushing public health campaigns focused on lifestyle changes, pointing out that regular exercise and a balanced diet not only enhance heart health, but also lower the risk of other chronic issues like diabetes and obesity. Experts from Johns Hopkins Medicine have added that mindfulness practices, including meditation and controlled breathing, can lower stress hormones and blood pressure, leading to better cardiovascular health. Harvard-affiliated cardiologists have conducted long-term studies confirming that quitting smoking and moderating alcohol consumption significantly reduce the chances of heart attacks and heart failure. Moreover, well-known figures in cardiology, like Dr. Valentin Fuster and Dr. Deepak Bhatt, consistently highlight that combining modern medical treatments with traditional methods, like Ayurvedic practices and dietary changes, creates a powerful effect in managing heart disease. Their research, often shared at global conferences, shows that a holistic approach to health, blending science and tradition, is vital for long-term heart health. These insights from respected institutions and experts make it clear that a well-rounded strategy, mixing regular exercise, balanced nutrition, stress management, and mindfulness, is the key to effective heart disease prevention. By tapping into solid scientific research and time-tested practices, individuals can take proactive steps to protect their cardiovascular health. Heart disease is a major health issue around the globe. Living a healthy lifestyle, getting regular checkups, and staying in the loop about heart health are crucial for prevention and management. Keep in mind that taking charge of your health and making smart choices is the way to go for a strong heart.